Hey guys, Real Doctor Jin here, board certified internal medicine. Do you enjoy watching Grey's Anatomy? If the answer is yes, you should subscribe to this channel. Subscribe, click here, because this is the only channel on YouTube to go over Grey's Anatomy one by one with you. Ooh. If you don't want to miss any of the episode, click the bell, get a notification for each episode. Today we have a guest, as you can see here. We watch a lot of Dr. Grey, but where's the anatomy? Here we go, here's the anatomy. And I have a name for him. Care. Jincare. Jincare. I hope this combination will help you live your life better.
A couple hundred years ago, Benjamin Franklin shared with the world the secret of his success. Never leave that till tomorrow, he said, which you can do today.
Never leave it till tomorrow, which you can do today. So if you like Grey's Anatomy, subscribe.
He had to say, I'd say it has a lot to do with fear.
Oh.
Fear of failure, fear of pain, fear of rejection.
Oh, this is a difficult...
Wouldn't it be easier to just ask her out?
Poor O'Malley poured 2 cups of coffee to his body, including the private area. Must be very painful. Here, let me share with you 3 most common mistakes people usually make when they get burned. First, icing. A lot of people's first response to the burn is rush to the tap water or the refrigerator to get the ice or the cold tap water to flush the skin. That's not right, because the cold water is too cold for the skin. It will cause more damage. Second, if you get a 2nd-degree burn, which means you had the blisters, do not popping up the blisters, because the blisters still helpful for the skin. If you popping up, the chance for the infection is going high. Third, to prevent the infection, somebody will use betadine to clean the burn area. That's not correct. If it's a normal tissue, betadine will definitely help, but when it gets burned, even the surrounding area, the cell is weak. If you use the betadine, it causes more burn, causes more damage. Ooh. So, no icing, no popping up, and no betadine. Ooh. Oh, seems the coffee is not that hot. He's lucky.
Tumor.
When we walk in this door, you will maintain decorum. You will not laugh, vomit, or drop your jaw.
Seems something interesting will happen.
Oh, just you wait.
Good morning, Miss Connors. Good morning.
Whoa, that's a huge tumor. What will be your response when you see this huge tumor? Please leave a comment. Here, show them where's the stomach. Here, it's a huge tumor on the stomach. In order for everyone to understand the case better, Care would like to introduce himself first. Here is lung. We have both lungs. And here is the heart. And here's the diaphragm. Here's the liver. This is the stomach. And this is the GI system. We call the gut. So patient's tumor seems to be on this area. Let's continue watch.
What is it?
Tumor.
Right, tumor.
Good morning, Annie. How are you? This is Dr. Bailey, and these are my fellow interns.
Dr. Carrera, we refer to patients as Mr.
I told him to call me Annie. Miss Connors makes me feel old.
This is very accurate. Clinically, we do have some patients, they very care about how we call them. And some patients don't like their names.
Dr. Carrera?
Oh, Annie Connors is a 43-year-old woman who presented last night with progressive shortness of breath for the past 3 months.
So this patient presents to the hospital with shortness of breath. Why shortness of breath? Your first impression may be, oh, the patient may have some nausea, vomiting, or diarrhea or stomach pain. Why shortness of breath? Let care help you. So, the patient's tumor is in the stomach, but that tumor seems huge. If you have a huge tumor in the stomach, it will push this one, we call diaphragm, up. And then that will squeeze the lung, make you shortness of breath.
Found to have a very large tumor of unknown origin pressed against her diaphragm.
Correct, against the diaphragm.
Dr. Stevens is going to take you in for a CT. It'll give us a better look at the tumor, and we'll know how to proceed from there.
So for a tumor, the staging is very important. We need to know how big outside. Also, we need to know how big inside. Does that involve some vessels, artery, vein? Then we can design the plan for the surgery. If it's close to the big vessel, like the aorta, the risk will be much higher.
I really want in on this.
Tell me more talking.
I'm not talking, I'm just saying.
Find her mother, get a family history, and tell baby.
As you know, Dr. Yang is always very aggressive for surgeries. Clinically, the one who presents the case will scrub in the case. It will be Dr. Crave.
Morning.
Oh, Parkinson.
This is Dr. Bailey and our fine staff of surgical interns.
Welcome to hell, kids.
Edward Levangie is a 63-year-old man admitted for pain management for dyskinesia. He's been stable since last night and responding well to the bolus injections.
Izzy, possible treatments?
For Parkinson's disease, deep brain stimulation is shown very
Not for Parkinson's, for spinal pain.
Intraspinal catheter.
Intraspinal catheter. Some patients have a chronic pain, and if we cannot remove the underlying cause for this pain, usually you need a long-term plan for the pain management. This intraspinal catheter will give you a long-term control for the pain.
Wow! That way he can have constant pain medication.
Excellent. It's Dr. Gray. She's going to prep you for the procedure and assist. Excuse me.
Easy is very jealousy. Dr. O'Malley present this case. Typically, Dr. O'Malley should scrub in this case. However, the Mike Jimmy asked Dr. Gray to scrub in. Special relationship. Dr. Bailey is watching them. Okay, CT scan.
Because I'm going to be right over there behind that glass waiting for you.
This is the CT scan. We always need the patient to be still inside of the CT scan. In that way, we can have high quality image to tell what happened inside the belly.
You ready? Are you really ready? Let's do this. See you.
Some patients may develop claustrophobia inside the CT scan because it's a very narrow space. In that case, you can let your doctor know and they can give you some sedative like Ativan to calm you down.
Unbelievable. Oh, I know.
Look at the tumor. It's almost the same size as the patient's belly.
She's just sick. Like warped, you know?
This is not nice to patient. Don't do that. Don't do that. The patient seems to be reluctant to go to the doctor. Maybe when the tumor is small, patient say no, and then when it grows bigger, it becomes a vicious circle. I don't know how many years this tumor has been there. It should be a long time. Now we are in the pandemic for coronavirus. A lot of people choose not to see doctors. That's not right. If you're really scared to go to the clinic to see the doctor face to face, you can do a telemedicine.
Second to last night, she couldn't breathe.
Because the tumor was crushing her lungs.
Yes, well, I called 911. It just seemed like the right thing to do.
You know, the right thing to do would have been to call a year ago.
Right, seems the tumor has been there for 1 year.
I'd prefer to start in front and then flip her. You never know what kind of vessels are involved, how intertwined they are. I'm gonna need a good head start.
I should really go with the spine fresh. I miss a step, she's paralyzed.
If I don't relieve the pressure on her lungs, she'll be dead, so she won't mind if she can't walk.
Based on the CT scan, the tumor has invaded a lot of places of the body. Here, let's explain this tumor a little bit. Basically, based on the CT scan, it seems the tumor has invaded the lung and the stomach and also the spine. So it needs a lot of specialist surgeon to do the surgery together.
People do things every day that they know could kill them. Doesn't mean they want to die.
What are the chances of surviving the surgery?
Slightly better than if we do nothing.
So is it worth it?
Well, the patient Annie agrees with this surgery. It's her choice. We will see.
I won't lie to you. The surgery is going to be long and difficult.
Right, this surgery may take hours. I remember I have a similar case, takes 8 hours. I don't know, this may take longer.
Am I gonna die?
There's always that risk. But if we don't do the surgery,
I'll definitely die.
yes,
Soon?
yes.
She'll have the surgery.
Mom!
No. No, Annie. She will have the surgery.
Always mom's baby.
I guess I'll have the surgery.
I think that is a very wise decision.
On one condition. I don't want him there.
I'm sorry, Annie. Did I upset you? So why?
If he's in the surgery, I'm not having it.
Oh, Alex is
That's
in
how it
trouble.
You are 60% more likely to be sued if you offended the patient. 60%.
I never said that stuff. The mic shouldn't have been on. I didn't realize she could hear me.
Well, now you won't realize your chance to scrub in. You're banned from the OR. Mine or anyone else's all week.
That is true. A lot of lawsuits came from the bad communication. That's why we have the professional training during the residency.
The history on the tumor, it's been growing for a year and a half.
A year and a half,
First time she's
wow.
been had it looked at. It's like she's fatally lazy.
Dr. Yang, watch your mouth. Does the patient have some special reason why she delays the care?
Why doesn't she get banned?
Go prep anacondas for surgery. You're scrubbing in with Christina.
Really? Oh, I mean,
Oh.
thank you.
Dr. O'Malley is lucky.
Okay. Why did you let it get this bad?
The first person since I got here to ask me that. Every time I went to the hospital, someone died. All 4 of my grandparents, and my dad, my best friend's mom, my baby sister, they all went in, never came out.
Oh, that's so sad.
So I put it off.
Sometimes we are afraid to see a doctor, but sometimes we may have other reasons not seeing a doctor. If you have similar experience, leave a comment.
Mr. Levangi, have you given any more thought about the other surgical options we discussed this morning?
What? Why would I? I already told you. No.
Dad, just listen to what he has to say.
I already listened.
Let me give you more information about DBS, which is a deep brain stimulation. That's a very mature procedure now. That can help the patient control the tremor very well. Sometimes you can see the miracle. Patient suddenly can start to walk.
And you have a chance to get better here. And all she's asking you to do is try.
Will the patient change his mind?
Mr. Levangi has agreed to DBS.
Oh, the patient agrees. We will see the DBS. So what is DBS? DBS basically is a deep brain stimulation. The neurosurgeon will implant electrodes into the brain. The medical device we implanted called neurostimulator. It can help the patient to control the tumor. I do see some case after the implant of this medical device. It's like a miracle. Patient is not tremor anymore and patient can walk by himself.
Mr. Levangi? Alright.
Joe gets charged.
Okay, they are doing the DBS procedure.
I'm right here.
Patient is awake and the patient can tell if the electropod is in the right place.
Okay, in that case, I'll stay where you can see me. Now we just have to drill a hole and try to find the spot that controls the motor function.
Can't see my brain from there.
I'm good, right here.
So during the DBS procedure, patients are awake.
Deep breaths. Focus on the pretty girl. Maybe those two. They've been holding that thing for 8
So they are resecting the huge tumor now.
You ever seen a vessel this size?
That's the vessel supporting the tumor.
This thing's just feeding on all the blood.
We need more O-negative.
For the blood type, if we consider a patient may lose a lot of blood, we will prepare the type and the screen for the patient and have blood available. Just in case patient lost a lot of blood, we can transfuse the patient right away. How many blood types we have? We have type A, type B, type O, and type AB. Do you know which type has the lowest chance to cause coronavirus? You are right, type O. What's your blood type? Leave a comment.
The probe is almost in. You'll know it when we find the right spot.
So they are trying to find the right spot to give the stimulation. If you find the right spot, patient's tremor will suddenly stop. Let's take a look. That's amazing, right? Amazing.
How about that?
There it is.
I'll be the son of a bitch.
That's the miracle. Good job, Dr. Shepard.
No pulse. Wide complex rhythm. I can't get this clot out. I need more suction. I need more. He's gradient down. You have to get the clot out.
Cardiac tamponade.
Screw it. I'm using my hand.
Wow.
You have to massage the heart, doctor.
That's very overwhelming for an intern. Oh. Finally, the pulse comes back. Here, I must give some credit to the nurses. I still remember a lot of nurses helped me during my residency. Some experienced nurses, they are very good. This guide us through a lot of difficult situations. Okay, so we have Care here to help you to understand what's the tamponade. Basically, we have a rib cage, and the size inside the rib cage is limited. When we have too much blood inside the rib cage, the heart will be very difficult to pumping the blood to the body. With the blood accumulating in the chest, the heart can suddenly stop. In that case, we need to remove the blood or remove the blood clot. If the heart cannot come back for the beating, then you need using the massage to jump start the heart. Good job, Easy. Oh!
Oh my God.
Get right in there. Get it.
It must be a very big vessel.
We need more blood.
Give me some suction here. I can't see what I'm doing. Plant, please.
Take this much blood loud.
This we call the massive bleeding. They need to transfuse very fast. Fast.
Pressure's dropping. She needs blood. Where the hell's the blood? We're losing her now.
Oh, the patient lost the pulse. Chest compression. Chest compression. Lower the bed. Lower the bed.
Oh, come on. Come on.
So, Dr. Shepard is doing the chest compression, which is correct. But in this situation, we need to lower the bed to get a good chest compression. What is high quality chest compression? That means you need compress 100 to 120 times per minute, and the depth should be about 2 inches. If the patient's bed is that high, you can't achieve 2 inches chest compression.
Time of death is 11:42.
We have to see for ourselves.
Look at the Parkinson patient. It's a miracle. Do you agree? Patient is now able to holding his daughter's hand in her wedding. Okay, this is the end of episode 6. If you like Jin Care's teamwork, give a huge thumbs up, and I will see you next week. Stay happy, be safe.